Uganda is one patient away from starting its 42-day countdown to virus-free. While across the border, MSF says the DRC response needs urgent scale-up. Same outbreak, 2 different clocks. If you're just joining us, the DRC's Bundibugyo outbreak began in Ituri and has since spread into a multi-province response, tangled up with infrastructure gaps, a disrupted workforce, rebel threats, and misinformation. Ebola reaching Kisangani, a major transport hub, raised real alarm, and separate response structures in the contested east have added another layer of governance trouble on top of the medicine.
This is Ebola Watch. Today, a discharge in Uganda, a first-ever joint contact protection trial, and China CDC pulling up a chair. Let's start with the good news that isn't the whole story. We're staying on DRC Bundibugyo Ebola outbreak. Follow the show, and you won't miss what comes next.
Here's TRT World.
Uganda is set to discharge its last Ebola patient on Thursday, marking the start of a 42-day countdown before the country can be declared free of the virus, a government spokesperson said. Under World Health Organization (WHO) guidelines, a country can be declared Ebola-free if no new cases are reported for 42 consecutive days after the last patient tests negative and is discharged.
Uganda is set to discharge its last Ebola patient, and that starts a clock. 42 days with no new confirmed infections, and the country can be declared Ebola-free.
42 days is deliberate. It's twice the virus's maximum incubation period per WHO, so that threshold has a real epidemiological purpose. If the virus is still circulating quietly, that window is designed to catch it.
So a traveler can actually mark a date. But I want to be careful here, because this is one border. The other side of that same outbreak is a very different story.
That's the tension to hold on to. Uganda's discharge and the DRC's trajectory sit under the same outbreak name, but the clocks are moving differently. Progress in one place doesn't rescale the other. Here's ReliefWeb.
Bunia. 2 months after the Ebola disease outbreak was officially declared in Democratic Republic of Congo, DRC, there have more than 2,000 confirmed cases and 750 deaths. Médecins Sans Frontières, MSF, is calling for an urgent scale-up of the medical response. The epidemic continues to spread at an unprecedented pace and into new areas, while efforts to control it remain insufficient.
MSF's number this morning? More than 2,000 confirmed cases, 750 deaths, 2 months in. And I want to be precise, those are confirmed, not suspected. In less than 5 weeks, confirmed cases tripled, from 650 to nearly 2,000 as of July 12th.
So, right after the Uganda discharge story we just aired, a 42-day countdown toward all clear, we have the same outbreak name attached to the fastest-growing Ebola on record. Very different days for one word.
That's the frame. The map has widened from 5 provinces, and MSF is saying flatly the response is still behind. Trish Newport's line, "We're still chasing the outbreak instead of staying ahead of it."
Third largest, fastest growing on record. Where's that ranking coming from, though? Is that a confirmed only count, or is it folding in suspected cases?
MSF is citing confirmed cases here, 2,000 confirmed. But you're right to press it. With a superlative like on record, I want the count behind it said out loud and held to the same standard we've used for every number this week. Radio 47 with Callan Amai.
This trial marks the first time scientists will test post-exposure prophylaxis for this virus in real outbreak conditions. The study will enroll up to 1,000 participants. A separate compassionate use plan covers children under 12 and pregnant or breastfeeding women using another drug.
The Ebo-PEP trial started July 14. It's testing obeldesivir, an oral antiviral, in high-risk contacts of confirmed cases within 5 days of exposure. Congo and Uganda are running it jointly, with a Lima ANRS INSERM and Africa CDC.
So, after the Uganda discharge piece we just hit, This belongs in the good news bucket too. There's finally a drug protocol for someone who's been exposed but isn't sick yet.
This is the first concrete clinical output of the DRC-Uganda coordination. Instead of another joint statement, we're talking about an actual enrollment protocol, and it's aimed squarely at the gap that's been killing responders.
Which matters if you've got someone in the field. Define high-risk contact for me, though, because the parent listening wants to know if their kid qualifies. Direct contact with a patient, a body, or a contaminated needle in the last 5 days and no symptoms yet. That's the door.
Right. Adults and children over 12, followed by 42 days of monitoring. And I'd add the honest caveat. There is still no licensed vaccine or cure for the Bundibugyo strain. This is a trial. Obeldesivir is still being tested. It hasn't been proven yet.
So the countdown clock in Uganda and the enrollment clock here are both 42 days. Completely different meanings, same number. One's counting toward all clear, one's counting to find out if a drug works.
From Wang Xiaoyu at China Daily.
China's National Disease Control and Prevention Administration said it has sent 2 public health experts to Uganda to join a newly established international coordination platform supporting the response to the ongoing Ebola outbreak in the Democratic Republic of the Congo and Uganda.
China's Disease Control Administration says it has sent 2 experts to Kampala, joining a platform that only became fully operational on June 29. The Joint Africa CDC WHO Afro-Continental Incident Management Support Team, based at Makerere University.
So there's a new table. And now a new government's pulled up a chair. 2 experts, out of Beijing, around midnight Wednesday.
And these 2 aren't generalists. China Daily notes both worked the Sierra Leone response about a decade ago. That was one of the deadliest outbreaks on record. Experience that specific doesn't grow on trees.
Here's what I want to know, though. A coordination platform only matters if it actually coordinates. Does joining it mean shared case data? Because the response still can't trace where most of these new infections are starting.
If Ebola Watch helps you track public health risks, try Food Recall Watch. Daily FDA and USDA food recalls, allergy alerts, and outbreak-linked notices. From Salmonella and Listeria to retailer polls and pet food advisories. Find it wherever you listen to podcasts. Next, we're watching Uganda's official checkpoint, the WHO's 42-day period after the last patient tests negative and is discharged. No new cases in that window would support an Ebola-free declaration. We're also watching the EBO PEP trial, which will enroll up to 1,000 high-risk contacts and monitor participants for 42 days after Obeldesivir. Links to every story we discussed are in the show notes, so follow up on anything you want to read in full. That's Ebola Watch for today. This is a Lantern podcast.